Hello everyone, I'm Dr. Akhil Tawari, consultant orthopedic spine surgeon. I welcome you all to another discussion that we'll be doing. Today I'll be talking on a very important problem of osteoporotic compression fracture. So as we know, with age, the quality of our bones reduce. If it reaches a critical value, it is called as osteopenia. And if it falls further below that range, then we face the problem of osteoporosis. It is equally common in elderly males and females. However, females in the postmenopausal age group are more prone to develop severe forms of osteoporosis. So, in simple words, osteoporosis means that the quality of bone has significantly reduced. Now, how does one present with? So, it should be noted that most of the times, osteoporosis is a silent problem. So, the patients wouldn't even know that they have significant osteoporosis till the time the bones become so weak that they fracture even with minimal trauma, like a trivial fall or just bending or lifting anything heavy. Amongst osteoporotic fractures, it is to be noted that vertebral osteoporotic fractures are almost twice as common as osteoporotic fractures occurring in other parts of the body. So, which also means that if an elderly person is complaining of back pain which is not resolving beyond 2 to 3 weeks, then it merits investigation. The most common symptom that the patients present to us as spine surgeons is back pain, which is not getting better. We Once the patient presents to us in our clinic, we do a thorough examination. Routinely, we see that with osteoporosis, the patients have a rounded back, so they are kind of stooped forward. With any kind of activity in the setting of fractures that elicits pain, to the extent that even turning in the bed is painful for the patient, we like to examine by gently thumping on the spine, and it is found that wherever there is fracture, the patient elicits an extreme reaction for pain. In rare cases, if the fracture is very significant, it can go and compress the spinal cord and can affect neurological status. So we also, by protocol, examine neurology for all patients who present to us in our clinic. Once we suspect that the patient has osteoporotic vertebral fractures, we first like to investigate. The investigation of choice to begin with is always an X-ray. X-ray, apart from telling us the alignment of the spine, it also helps us to know if any particular bone has compressed. That means whether the size of that particular vertebra has reduced, which is then classified as compression fracture or a vertebral compression fracture. We also routinely like to get MRI scan. MRI also tells us about the soft tissue structure, and it also tells us if there are other fractures which have already happened. So whether it is a new fracture or an old fracture, that information also we get from an MRI scan. So we also like to keep a low threshold for getting an MRI. MRI is also important if we are suspecting any compression on the spinal cord, because that information we will never get based on the X-ray. Now, the diagnosis of osteoporosis also means that we have to know what is the quality of the bone. For this, we do a specialized test which is called as a DEXA scan. It is kind of a specialized X-ray in which values are given on the quality of the spine bone and any one of the other bones in the body, and we like to then grade the level of osteoporosis. Once there is a confirmation of osteoporotic compression fracture, the treatment is comprises of two parts. First part is to take care of the vertebral fracture, and the second part is to take care of the osteoporosis that has set in. We usually like to take care of both the problems at the same setting. It's good news that majority of these patients get better by 6 weeks to 3 months of taking pain medicines and also taking treatment for osteoporosis. The pain medicines can be routine painkillers, that is the non-steroidal anti-inflammatory drugs, but it has been found that the opioid analgesics, they work the best, and we routinely like to give it to the patients. That is purely for pain management. We also like to give the patient a brace, and the patient is told to take as much rest as possible. So we usually give the patients toilet privileges and bed rest. The treatment for osteoporosis per se depends upon what is the level of osteoporosis. So either we can manage it with routine tablets. Sometimes we have to give specialized nasal drops, which are called as calcitonin drops. If the osteoporosis is very severe, we also like to give artificial parathormone or monoclonal antibody, which is called as denosumab. Majority of the patients get better with rest, medications, and treatment of osteoporosis. However, there are a minority of patients who continue to suffer because of pain if the healing capacity is significantly impacted. In such instances, beyond a reasonable time frame, we like to offer the patients intervention. The interventions are of two types: either it is a kyphoplasty or a vertebroplasty. Essentially, the process in both is the same, that whatever bone has become deformed and is not healing, we like to put in a needle, and inside that bone we like to put specialized form of bone cement. The cement hardens over time and not only provides structural support, but it also helps to alleviate the pain. The other biggest advantage for these procedures, both kyphoplasty and vertebroplasty, they are minimally invasive. So we don't have to make big cuts. We make small incisions, and we then stick in the needles inside the vertebra which is affected. These are very effective ways, both kyphoplasty and vertebroplasty, for pain relief. The patients are able to become pain free almost immediately and can go back to their routine daily activities. In rare cases, if the fracture is so significant that it goes and compresses on the spinal cord as well, in those instances, apart from doing vertebroplasty, we also need to decompress, that is, take out the pressure from the spinal cord, and also need to put screws and rods to support or form a bridge on the damaged bone. This is in the form of putting instrumentation and fusion using pedicular screw system.